Stimulating Minds on ABC 27 is presented by Penn State Milton S. Hershey Medical Center.
A Cumberland County man feels deep brain stimulation gave him a second chance.
61-year-old Tom Schaeffer rises early and spends most of the day on his farm. The dairy cattle business is his life.
We have 4 farms here, and we have about 500 acres. We have Holstein and Jersey dairy cattle. And the only thing we really work with are the heifers.
When Tom's not on the farm, he's in the woods hunting.
I hunt a little bit of everything, deer and elk. I've gone hunting for a bear, but I never shot any yet. I got a nice big mountain lion.
Farming and hunting, skills he learned as a boy. Now as a man, Parkinson's slowly took them away.
I started having a shake and a tremor in my left hand, and it was about 14 years ago. And I went to the doctor, and he said, "I'm afraid you're in trouble. I think you have Parkinson's."
For Tom, like most Parkinson's patients, it progressed slowly, but it did get worse.
It went from my left hand to my left foot a little, and then my right hand started, and then my right foot started. It would get so bad at times that I'd sit on his hand like this to keep it from shaking when we'd go away to eat or something.
The tremors affected almost every aspect of his life. Imagine holding a gun with Parkinson's.
I got to the place where I couldn't even hit the target anymore because I couldn't hold the gun still. I had to hold on to the gun with both hands just to try to shoot it. I buy and sell a lot of cattle, and it got to the place where I just about couldn't write a check because my hand shook so bad. That's a little embarrassing when you buy a man's cows and you pull out your checkbook and you can't write him a check.
Tom read some great news about Parkinson's and deep brain stimulation while on an airplane. It gave him hope. He knew he had to have it done.
Deep brain stimulation will help normalize the brain function, so for make the patient function normal with minimal medication. So deep brain stimulation is really good to help with the tremor. Probably their slowness too. They're walking, and then those quite dramatic.
2 years ago, Dr. Jim McInerney mapped out Tom's brain and implanted the device.
You have somebody who's living a very active and productive life, the way Tom was, and he starts to see that being eroded by his disease. This is the kind of thing that can make the difference and get him back to where he was.
But when they turned it on, it's just like a new day.
No more shaking. Now Tom's day starts either on the farm or in the woods.
Since I've got this done, it was like the first day of my new life. That old cloud that was always over me is gone. So it's really been a dream come true, and it's been a blessing.
Now, Tom was diagnosed with Parkinson's when he was 47 years old. He lived with the disease for 12 years before he had the surgery. He said at first the medicine was effective, but then as it went on, it was not nearly effective for him. Now, Tom does joke about his hunting. He says that now if he misses a target, he can't blame it on Parkinson's. Back to you, Val.
All right, thank you, Deborah. Besides Parkinson's and essential tremors, what other diseases can be treated with deep brain stimulation?
Well, it's approved for dystonia, which are abnormal motor movements, and recently it was also approved for obsessive-compulsive disorder.
So how will it help a patient with OCD?
Well, the first thing that patients with OCD seem to notice is an improvement in the depression that they often have. And they often see that within a couple of days, or even on the operating table. And then over the course of the next weeks to months, the obsessions and the compulsions that are really the hallmark of the disease start to become less important to them, and they start to stop doing those things, and they return to more normal lifestyle.
Live their life. All right, thank you, doctor. We'll be back in a minute.